Welcome again, everybody. Dr. Todd Smith, internal medicine physician here in Princeton, West Virginia. Yes, West Virginia. And we're here trying to discuss ways of improving healthcare. Have several videos now on this, and I'm covering different topics. This topic actually is going to be a really interesting thought. And I really think that, obviously, I won't be posting it, that this might actually have some good intentions. And that is focusing on the administrative healthcare costs that are out there. Our problem that we have here is that there is differences of healthcare throughout this nation. We do have our standards of care that all physicians and all providers need to adhere to. But then the problem is that those standards of care cannot be maintained to a certain degree depending upon where you live. Here in Princeton, West Virginia, I can tell you that if you are needing neurosurgery, rheumatology, if you are needing a lot of subspecialties, we are very limited here. Every area of this country has different needs. They have different availability of care. They have different structures of need. Yet, we're all sort of looked at the same way from multiple insurance companies, from Medicare, from CMS. Let me give you another little striking thought here. CMS. Now, this was last year's data, but CMS last year, which actually we're just going to say was the year of 2018, their administrative costs, not what they put out for care, the administrative costs of CMS was $8.1 billion. Administration. Think of the money that is in insurance companies. And the problem is that these people are the people that are dictating your care. They're the people that are going to dictate your care, and they're also the people that are going to go home after they punch the clock. They're going to go home and they don't know you, they don't care about you. Your providers do if you have the right provider. So what we need to do is we need to take that control, that understanding that various areas throughout the country have different needs. We need to understand that the costs that we have right now, with all of the organizational costs and administrative costs, is ridiculous. How do we fix it? I've got an answer, but let's go a little bit further. A lot of this has come about because providers in the past have abused the system. We're human. Providers have abused the system. So we as providers need to be a little bit more responsible, and the patients need to be a little bit more responsible. So how can we help and remain adequate in health care in the region that we have, perform the best care that we can with what we have in that area? How can we do this? Well, one thing that I felt like really needed to be done is we need to have more local and regional control. That is something that I think is going to be paramount to everything I've discussed. Taking control of fraud, taking control of abuse, taking control of providers that abuse the system, or maybe taking control of providers that are not educated in a certain area enough that they are overutilizing a lot of the resources that they really shouldn't be doing. So why don't we get a little bit more regional control in West Virginia? Maybe 2, 3, 4 regions throughout West Virginia. And there is a board that is composed of providers, physician, nurse practitioner, nurses, physician's assistants, pharmacists, hospital administrators, EMS. And now we have this board that is going to be overseeing all of the aspects of medicine in their region. Now, this board is going to have to report back to state and federal governments to be sure that they are maintaining the standards of care that need to be. Now, let me tell you why that this has a very good chance to work. Because there's a couple things here. You have actual providers that are familiar with the people in the area, and those providers can adequately monitor what is happening in their region. That is very important. Here's the other thing. The other thing is, if they find that there are physicians that are overbilling, that are overutilizing certain tests, that are not practicing standards of care, then they can take those individuals and those physicians and they can set them up education on what those providers need in order to provide standards of care medicine and to decrease costs. And then the doctors that are performing standards of care and their costs are where they need to be and their utilization is where they need to be, guess what? They're left alone. Does that sound crazy? So you're actually improving the quality of care for the people that need it. So local control can help this, but again, this local control has to be submitted to state and federal agencies in order to be sure that they are meeting compliance. Now, who's going to be on these boards? I know you're asking that. Well, it can be people that are considered to be representative of their certain profession. So the pharmacists can get together and decide who they want to be on the board. The physicians can decide who they feel like is good to be on a board. And these people have got to be willing to be on a board. But also, I think there should be a little bit of a tax incentive so that they have a reason to be there. You don't want to take someone who is retired for 10 years and put them on the board because, in all fairness, those people are really going to not be up to date on what needs to be done. So really what you need to have people that are in the system, that are working in the system, to agree to be on these boards. And these boards are going to have to go and they're going to have to every month be associated with seeing their individual clients, members of the board, and they're going to have to be sure that these members are maintaining the standards that need to be maintained. This can be done. It is not that complicated. But the benefit of this is that we have more people that are on regional and local boards that actually have to go back to their constituents and they have to say, listen, you're not doing this one right. We need to focus more on this, and we're going to help you to be more appropriate in your care and your utilization of medicines or images or whatever. This board is also going to focus on hospitals, hospital usage, hospital utilization. It's going to focus on pharmacy. It's going to focus on the whole aspect of healthcare. And this can be done. And I really believe that having an oversight of the entire system, but on a more local, regional level, is going to improve costs. It's going to educate people in areas that they need educated. Think about that for a little bit. This can work. And for any skeptic, again, I've said it before, I'll say it again. For any skeptic that says a negative thing about what I'm saying, I've got a bunch of data that says, no, what we're doing is not working. So rather than saying, none of that will work, well, maybe a little bit of what I've just said would work. And if that would, maybe a little bit more of our funds, a little bit more of the amount of money that we're spending on medicine will be focused in the right direction on patient education, patient care, and patient responsibility, in addition to all of that with the providers too. So think about this one. Think about this one hard. I know that this might be a little bit tough to conceptualize, but don't you think it might work? I can tell you one thing, from a provider standpoint, this would be a heck of a lot better than someone that is in California, Seattle, Nebraska, wherever, working for an insurance company that is trying to tell a physician in southern West Virginia what he's doing wrong. Think about this. And there's a lot more to come. I've got several other videos coming. And like I said, I hope that you all will think and consider this very hard. I really do want to make a change.